Wild.
I appreciate you sharing your story.
Thank you very much.
Thanks very much. We're going to take some
Dr.
more
Gulani.
viewer emails here in a second. I want to remind you that Dr. Gulani is also an inventor. We'll talk about those inventions and how they have changed the way you're treated coming up in just a second. That said, let's field this question from Patty in Orange Park. Send it in to Ask Dr. Gulani on news4jax.com. I hear the advertisements on TV, and each doctor seems to have a different technology available. How do I know what's best for me?
So, Bruce, same thing again. First of all, go in and meet the doctor. Second, again, like I said, your technology question doesn't even get there until you first find out what's the procedure for you. So you go in, your question is always going to be a very simple question. Doctor, I'm tired of wearing contacts and glasses. What's the best option for me, keeping my safety and my best interest in mind? Once they come up with that technique, now you go into, for that technique, doctor, what technology are you using and why? Are you the inventor? Are you the person who teaches with this technology? How do you know this is the best for me? You have the right to ask that question, surely. But again, that's the sequence. First question is still, what am I a candidate for? And then, for that surgery, what technology are you using? Then you'll get more knowledge about why that doctor is using that certain technology. And you have all the rights to sit down and say, doctor, please, I want you to explain this to me. Even if the technician's walking you through, I mean, people do screenings. I don't really agree with that. I would like the surgeon to sit down with the patient, because that, I believe, is the biggest reason for consistent success.
And, you know, we don't want to appear redundant here, but I think it's interesting that many of the questions have the same tenor, because we've been inundated, you know, with the advertisements we see on TV, here on the radio, and look at in the newspapers and magazines. So there's this culture created where people think that it's all the same thing. And you've really, pardon the pun here, cleared that up for everybody who's watching this webcast right now. Let's talk about some of the procedures that you've brought. Tell me what they are, some of the inventions you've brought about, and how they've really changed the way people are treated.
Inventions, you can first classify, so this answer makes sense, diagnostic inventions and surgical interventions or inventions. So diagnostically, my focus has been for quite a few years now, as I teach all over the world, is how to make LASIK more predictable, more safer, and how to diagnose who not to do it in. So technologies like the Penacam that we have now, or using protocols with existing machines, is also something unique. There are ways to find out what patient is good for what surgery. These protocols and classification systems we have published. Now we are writing textbooks with it and explaining in video journals and teaching, of course, nationally, internationally. So other doctors can adapt the protocols and understand this concept of, even if I'm looking at someone with glasses, in my mind, how all these surgeries must stay unbiased, and then I decide which particular surgery I'm going to do for this particular patient and why. The second level of innovation is surgical, with various instruments that I've designed for LASIK, which are used by surgeons all over, even for intraocular surgery, for ICL, for cataract surgeries, how to make the surgeries more elegant. So it's less barbaric, it's less interventional, it's more accurate. And these are, again, the important goals that you start out with. Invention is nothing more than addressing a necessity. What's the necessity as a doctor, as a surgeon who wants perfection? It is safety and elegance.
And it is the patient's best interests
always
at the forefront. What changes do you see in the future? And maybe I'm getting into something proprietary here. Are you working on some things that will change the landscape even further?
Yes. As you know, Bruce, we've done something on this. So the 3D way of doing surgery, three-dimensional, which I think is the future, where doctors will not be stuck to eyepieces. They'll be seeing things like on an IMAX theater and operating. Being a teacher, that's also great, because I've predicted picture-in-picture concepts that other doctors can follow and learn to while they're operating. I believe the future is going to be prevention. It'll reach that stage, like any other disease. I mean, why do people get nearsighted, farsighted, and have a stigma to them? So now you have, Bruce, a very deep topic here, actually. There are 3 levels. One is people who are born with these conditions, what we call natural, nearsighted, farsighted, stigmatism. Second, are age or disease-related, like example, cataracts, age-related. Disease-related, like keratoconus, when your cornea is so curved that you become a cone, so you can't be fit with contacts or glasses and can't have LASIK. So we put rings in that. Third level is very important, and which is really brewing into an epidemic, according to what I've been talking about, is the people who had surgery before. Millions of people have had LASIK. Numerous people have had radial keratotomy, which was before LASIK, the incisional surgery. All those people today are looking for help to further enhance their vision, because either their vision has gone down, changed, or other things have happened which have distorted that vision. That whole population now is looking to what I call corrective LASIK surgery. So you can correct previous radial keratotomy, you can correct previous cataract, you can correct previous LASIK and bring them to the 21st century.
I've been in your office, and essentially what you can do is you can look back in time and see what was done, which helps you better plan for the future. All that said, before we run out of time, I want to remind you, you've got the email link on Ask Dr. Gulani at newsforjax.com. His office is over on the south side. You can certainly give Dr. Gulani and his staff a call at 296-7393. And remember, he said here, he'll sit down, he will spend the time to talk to you to make sure you're treated the way you deserve to be treated. So remind him that you saw that. Can we pop that up again real quickly once again and give that 800 number, which is toll-free for people who might be watching outside of the area. It's 888-LASIK-16, or you can go to his website at GulaniVision.com. Dr. Gulani, always a pleasure.
My pleasure, too.
And we appreciate you watching this live webcast on newsforjax.com.